name is Yulia Kriskovets, and I'm with the communications team of the Feldenkrais Guild of North America. And I'm very excited to interview Alan Questel today. He's a very well-known Feldenkrais trainer and practitioner for over 40 years, I think.
Yeah, 40 years. Oof, yeah, 40 years now.
Yeah. Yeah, and Alan has graduated from Amherst training with Dr. Feldenkrais and has himself been director of the many trainings and taught at many trainings around the world. And he also has created a audio series on walking, which is partly why I wanted to interview him, because the topic of this month's issue is walking, and walking is an activity, and how can we make it better? How can we improve this activity? Welcome, Alan.
Thank you. Thanks for having me, and it's nice to see you here, and hi to everybody out there.
Well, my first question is, why even try to improve walking? We learn it as babies within 1 year by ourselves. What's so difficult about it?
Well, and from that point of view, there probably isn't anything that's so difficult about it, other than the habits that we engage in around it, which often later on can create some kind of difficulty in walking. And of course, many people find challenges in their walking. There's no question about that. And so improving that is in one way improving an essential aspect of our life, because most of us spend a fair amount of time walking. And even if it's just walking to the bathroom or to the kitchen, if that doesn't have a particular quality to it, life doesn't feel so good or happy.
And I mean, so you think it's pretty simple, or is there some parts of it that are complicated?
No, I didn't say it was simple. I think it's quite complicated. And where we can really see where it gets complicated is when someone loses the ability to walk and has to regain it. And most of us don't realize what a long apprenticeship we have in movement to get to the point where we can actually walk. And it begins, of course, with crawling, just to standing, to having an intention to move towards something. So it's significant, and it's pretty complex because, we could say that, of course, there are different patterns of movement. There's rounding or arching, flexing, extension, side bending, rotation, and walking encompasses all of them. And it's the distribution of those patterns of movement through the whole person that allows them to walk more efficiently, more gracefully, or less so. But it's not easy. It's not easy.
And when you see your clients, I assume you're still seeing some private clients in your practice. Do you evaluate their walking as a part of how you assess their movements?
Yeah. I think from the moment it's always been true, from the moment someone comes into my office, I usually kind of say, well, go to the right, and I follow them in. And while I'm following them, I'm watching them. And I would say that, in every lesson, pretty much every lesson, I spend some time working with them in sitting, in how to come from sitting to standing, how to sit more effectively. And also, once they do that, how they walk, right? And there's actually, I have a particular focus around walking that I think would be understandable to most people. And that is how someone is engaged around the movement, or the lack of movement, in their hip joints. And I find most of us don't have a clear sense, I included myself in that for many years, a clear sense of where our hip joints are. And if we can mobilize movement in that area more effectively, it's significant in walking as both an axis of movement, and because of the large muscles that are around the pelvis, if they can become better organized, walking can become a lot easier.
Yeah, that makes me think of, sometimes I tell some of my clients imagining their feet growing out of their pelvis.
Yeah. I do that with hands too, coming out of their shoulders. So they involve more of themselves. But then you bring up the feet, and then it's also like, what part of the foot do they use to course, when we walk, we strike on the heel, come to the outside edge off the ball of the foot. But at the point where we're really over the foot, we're at the front of the heel, which is not talked about a lot, actually. And it's a moment, but if we can find that moment in time and space, there's a tremendous amount of stability that can be gained from that. And then it connects directly to the hip joint opening in the front, giving more stability and support for the rest of the person as well.
So finding the plumb line through.
Yeah, it's a particular plumb line for a moment, because then it changes again, right? So it's quite a dynamic thing. And that's another thing certainly people do that with posture. They try to find a plumb line that keeps them erect, but it's static. But in walking, that plumb line is really malleable and it changes constantly. And, people talk about walking as a way of not falling, right? But then you have to have some understanding about falling and regaining the ability to regain stability and make it dynamic that way too. So it's a pretty complex thing, walking.
Yeah, and you mentioned feet. I think many people, especially as we age, we lose sensitivity in our toes and feet.
Yeah.
And have you noticed that in people you work with?
Yeah. But that's where, look, I can think of working with people who are paraplegic, who couldn't walk, right? But yet, when they're walking with two crutches, let's say, and they're putting their feet somewhere, and when the foot is placed in this, look, we can think of our legs as canes or sticks. And when someone has a cane, it's interesting. They know exactly where to put the cane. They can feel when it's in the wrong place. And if they're not sure, they get one of those canes with four prongs at the end of it to find a greater base of support for stability. But someone who can't feel their legs can feel above their legs, and they can feel when their pelvis or chest is over something that gives this part of themselves a sensation of support. And so even when people don't feel their feet clearly, they can find an easier way of walking. But one of the things that I see that interferes with them a lot is that their emphasis on trying to get somewhere, to do something, where I find if someone takes really short steps, they can actually maintain the stability and mobility more effectively. And the image I think of is always like men or women in cultures who carry things on their head. You never see them take a long stride. If they took a long stride, it would throw them back, they'd have to contract and everything would get tight again. They take short steps and their head is always over that foot. And we don't see that, nor do we really value that as much as we can. Because it's something that I always start out with people in walking and say, take really short steps so you can feel what's happening through the rest of yourself. The long step is I see it also in limping. You see someone hurts their foot and they take a really long step with one foot and a short step with the other foot because they're trying to get somewhere. But if they and that throws everything off, and if they do that long enough, they destabilize their organization. I've done that to myself, where it took me a long time to regain it again. But if someone takes really short steps, they have more control, more reversibility over what they're doing, and it's more pleasurable. They can like the way they move much more.
That's so interesting. I definitely did that, and still doing it probably myself, especially when I'm rushing somewhere. And another thing that I used to do is lean forward a bit as if I'm going to get there faster because my head is there faster. So that's interesting how our perception of things can affect our movement, right? It's like we have this picture that we're trying to match, and it's not always true to reality.
It's funny when I drive somewhere and I'm in a hurry and I feel myself passing cars, and then I finally get off the highway and I get at the light and the first car I pass just slowly pulls up next to me and I go, I didn't really save any time there, did I? It's just that feeling of getting somewhere more quickly, which we all engage in. Yeah.
And So you mentioned about small steps. Are there other really valuable parts of that complex activity that you would mention as something that's really worth investigating for,
Well, I would say I already mentioned being able to mobilize around the hip joint. Specifically, what I mean there is that as I come over the foot, that the front of the hip joint opens. And if that happens well, I actually can't hyperextend my knee, and my lower back doesn't have to work so much. And then, of course, to be able to do that, I need to be able to push off the back leg. Many people pull.
Would you show us the hip joint, the front of the hip joint? Because I know some people may have difficulty.
The front of the hip joint is here. It's the crease where the leg meets the torso. And when we walk, many people hold themselves tight here and walk using their lower back, as opposed to feeling that this can open here. And when that happens, the distribution of effort muscularly changes dramatically. So that's one thing, right? I mentioned being able to find the front of the heel as a point of stability. So that's another big idea, I think. But then, to really answer your question, it depends on the individual. So like you asked earlier, if I observe my clients when they come in, yeah, I do. And some of the things I look for is where do they move a lot and where do they move not very much? So for example, some people, they rotate a lot around their pelvis, but there's not much rotation through here. Or some people, they side bend a lot when they walk. And nothing's wrong with these things. People move through life like that very well. But the question is, do they need to side bend that much? Maybe if they're side bending so much, they don't have much capacity to rotate or to flex and extend. If most people who are flexed in their habits, when they try to extend themselves, it's all on the lower back again, right? And so, there's an author named Gradovetsky who wrote a book called The Spinal Engine. And he makes he's an engineer. It's a very dense book, but I'll just give you the gist of it. And he talks about how the spine is the mobilizer for walking. And one piece of evidence that he gives, and you can find this on YouTube or his website or something, is a video of a man who has no legs. I think he has no arms too. And he walks on the bottom of his pelvis. And you can see that the act of walking doesn't have much to do with the legs. And, one of the places where I got a tremendous amount of insight into this was a man I worked with, young man, 23, many years ago in New York, and he'd had some kind of cancer and radiation, and he lost the ability to walk. And he had 2 sticks, and he would kind of lumber into the room in this awkward way. And every once in a while, he would take a few normal steps. And I'd look and go, what did he do? And I started to realize he was using his back differently when he did that, because he didn't have much control over his legs. But when he used his back a certain way, his pelvis a certain way, his leg would get placed in a more efficient place, and he would step a few steps like that. And so actually, most of my workshop on walking is based on that guy, because that's where my interest in walking got piqued. And I decided to think, well, how can we walk better? And of course, if we walk better, we can run better, we can ski better, we can get in and out of a chair better. So it affects all the many aspects of our everyday life, which is pretty important. So
it comes back to this idea of sort of neutral uprightness, right? Without too much muscular effort, holding yourself up. And it's almost, it seems like it's almost easier to walk than stand, to standing in place takes more effort. But we're sitting so much these days, right? So you talked about opening the front of the hip joint, but yet we're always constantly flexing that hip joint for sitting.
In sitting, it's the opposite. In sitting, we need to flex to close the front of the hip joint to sit more erect. And what you said a moment ago about standing still, a good image for this is somebody who's on stilts. So their center of gravity is raised way high. Their base of support is even smaller than a foot usually, and so it's very unstable. But if you ever talk with someone on stilts who's standing still, you'll see they're always moving. They can't if they actually stand still on stilts, they'll topple over. And so we're meant to be dynamic like that, to walk and to stay in some, even I just gave a lesson to someone this morning, and she was talking about how her back starts to bother her if she's like at a museum looking at something. And I just said, look, just put one foot a little forward and just shift your weight back and forth and feel, how does that happen, as opposed to trying to stand equally. And I've just, again, had a recent client who had this idea of standing equally on each foot, which doesn't exist. It's a human idea, you know, that we should be symmetrical like that. And it's where people create more trouble for themselves, actually, you know. And that idea of what you just said about, how did you say it, less muscular effort. But there, what the key to that is being able to find our skeleton to support ourselves more efficiently.
And that's where Feldenkrais comes in, right?
That's where Feldenkrais comes in, yeah. Yeah.
Well, I guess I don't want to hold you for too long, but I do want to get any parting advice, you know, if someone is struggling with walking, you know, what are the things they could do?
Well, you know, in one sense, doing any awareness through movement lesson can benefit them, because in most lessons, there's a redistribution of our muscular habits. There's more of an introduction of skeletal support. So almost any ATM, and of course, seeing a practitioner privately would probably be the most beneficial thing, because anyone's particular difficulty or challenge in walking is idiosyncratic to them. So like all the ideas that I've talked about would probably be part of the lessons that you would do in awareness through movement or functional integration with people, but they'd be tweaked or focused on in different ways depending on each individual's need and what they have to do and what they have to work with too. Because the limitation that someone has may mean that walking takes on a whole different quality than they would have thought or imagined it to be. Usually pretty far away from any ideal or correct way of walking, but back to a kind of underlying principle of what we do is, can you fulfill your intention? Can you do what you want to do? And then I would add to that, one of my major ideas is, can you like yourself more in the process? So the better quality you can bring in your movement, the more we can like ourselves in a way that's gentle and kind and really rewarding over time as well. So those would be my biggest things.
I like that very much. It would be a nice exercise, being kind to yourself every time you walk.
Well, I'll tell you, I'm about to publish a new book, and it's called Practice Intentional Acts of Kindness and Like Yourself More. And it's really about kind acts towards ourselves and others and liking ourselves. And there's actually a chapter about moving in a way that you like the way it feels, as a way of being kind to yourself, which you can practice anywhere at any time, you know? So it's, yeah, I'm glad to hear I like it too. Yeah, it's good. Yeah.
Thank you so much, Alan. It was a pleasure.
My pleasure. Thanks for having me.